Go ahead.
Okay, sir. Shall I start?
Yeah, you start.
Okay, sir. My topic is epilepsy. Epilepsy is a disorder characterized by recurring of seizure, also known as a seizure disorder. Seizure is a brief, temporary disturbance in electrical activity of the brain. A seizure is symptom of epilepsy. Sorry, sir, 1 minute. I have to admit to another person is there. I think they come late.
You click on like you set the option that they should not take your permission to come in.
Yes, I just have to let them to come.
Yeah.
Okay, sir, I will continue. Who has epilepsy? It is estimated that there are more than 10 million persons with epilepsy in India. Its prevalence is about 1% in our population. 50% of people with epilepsy develop seizure by the age of 25. However, anyone can get epilepsy at any time. Now there are as many people with epilepsy who are 60 or older as a children age or younger. What caused epilepsy? In about 70% of people with epilepsy, the cause is unknown. That means we don't know what epilepsy is happen. In remaining 30%, the most common causes are head trauma, brain tumor, and stroke, lead poisoning, infection of brain tissue, heredity, perinatal disturbance of brain development. Sir, you have my voice?
We can hear you, yes.
Yes. Group at increased risk for epilepsy. This group may increase risk of epilepsy. About 1% of general population develop epilepsy. The risk is higher in people with certain medical condition, mental retardation, cerebral palsy, Alzheimer's disease or disorder, stroke, autism. The brain is source of epilepsy. That means the epilepsy is one disease about the brain. All brain function, including feeling, seeing, and thinking, moving muscle, depend on electrical signal passed between nerve cells in the brain. A seizure occurs when too many nerve cells in brain fire too quickly, causing an electrical storm. And this is the epilepsy picture. Healthy brain is like this. Generally, the epilepsy is this is type of epilepsy. It be like this, and focal epilepsy or partial epilepsy is like this. Seizure. Sorry. Type of epilepsy: generalized epilepsy, focal epilepsy. Seizure, partial, generalized. Partial includes simple partial, complex partial. Generalized includes absence, tonic-clonic, myoclonic, atonic. Primary generalized seizure. The different type of primary generalized seizure caused by different symptoms. Generalized tonic-clonic seizure, also called grand mal seizure. The person usually lose consciousness and fall to the ground. All body muscle can contract at once, or they can contract in a series of shorter rhythmic contraction or both. Some patients also lose bowel or bladder control. They can control the bladder or the seizure episode typically lasts for less than a minute, is followed by a period of lethargy and temporary confusion. For temporary, they will be confusion. Often muscles are very sore after generalized seizure. Absence seizure is another type of generalized seizure. Absence seizure, also called petit mal seizure. In this type of seizure, loss of consciousness is so brief that the person usually does not change the position for a few seconds. The person may have a blank stare or rapid blinking. This type of seizure usually begins in childhood or early adolescence. Next one is status epilepsy. A state of prolonged seizure is about 20 minutes or maybe longer. A series of seizures with fully regaining consciousness. This is life-threatening medical emergency.
Can you let in everyone? They are waiting. Please accept.
Yes, 1 minute, I will accept. Okay. The different type of partial seizure cause different symptoms. This is partial seizure, another type of seizure. Partial includes simple partial seizure, complex partial seizure. Simple. The seizure-related electrical discharge remain locally so that the person experience a feeling, sensation, movement, or other symptom without losing consciousness. During a simple partial seizure, the person remains awake and aware. Symptoms vary depending on the specific brain area involved may include jerking movement in one part of the body and experience of abnormal smells or distort environment, unexplained fear or rage. Complex partial seizure. This is most common type of partial seizure. The person loses awareness of surrounding and is unresponsive or only partially responsive. There may be a blank stare, chewing or lip smacking, or repetitive movement of the hand. Repeated the hand movement. After the seizure, the person typically is confused and has not memory of episode. He don't remember anything. Symptoms that may indicate seizure disorder. Period of blackout or
Sanaz, can you accept everyone? They are waiting. You're not accepting them.
late. I don't know because
They
after
are from starting only, but you're not accepting.
yes, okay. Okay, shall I continue?
Okay.
Okay, next one is episode of blank staring in children. Sudden fall for no apparent reason. Episode of blinking or chewing at inappropriate time. A convulsion with or without fever. A cluster of swift jerking movement in babies. This is especially for. Okay, seizure triggers. Seizure triggers. First one is missed medication. That means you forget to take medication. Stress, hormonal change, dehydration, lack of sleep, fatigue, photosensitivity, or next one is drug, alcohol use, or drug interaction also can cause. Okay, seizure first aid. This is especially for babies or child. Okay, first one is do not panic. Turn on their side and start timing the seizure. Stay with child, do not restrain. Place something soft on their head. Do not put anything in mouth. Call 911 if seizure lasts longer than 5 minutes. First aid for seizure. This is for adult and this thing. Stay calm and track time. Do not restrain the person but help them avoid hazard. Protect head, remove glasses, loosen tight neckwear. Move anything hard or sharp out of a way. Turn person on one side, position mode to ground. Next one is check for epilepsy or seizure disorder ID. That means before he had epilepsy or not. Understand that verbal instruction may not be obeyed. Stay until person is fully aware and help reunite them. And last one is call ambulance if seizure lasts for more than 5 minutes, like that other type also. If it is unknown whether person have before period seizure, that before he had seizure. Okay, this is do not. That means this thing we don't have to do in that situation. Do not put anything in a person mouth. Do not try to hold down or restrain the person. Do not attempt to give oral anti-seizure medication. Do not keep the person on their back face throughout convulsion. How is epilepsy diagnosed? This is clinical assessment, patient history, test like EEG, blood test, CT scan, MRI, PET, neurologic exam, ID of seizure type, and another type is clinical evaluation to look for cause, that for what this is happen. Okay, treatment goal in epilepsy. Help person with epilepsy lead full and productive life. Eliminate seizure without producing side effect.
Sorry to interrupt, Sanaz. A few of our friends couldn't join it.
See, Sanaz, there is a setting actually where you can see the participant now. When you click on the participant, put in waiting room option is there. You disable that.
Okay,
Put in waiting room option is there. No, when you click on that,
yeah,
you'll get enable. Not admitting. I'm not telling you to admit all. When you click on more, no.
Very far late.
Put in waiting room. Put in waiting room. You click there and disable the waiting room option.
Okay, sir.
Disabled?
Yes, I already do that.
Disabled, huh?
Yes, disable. I do it.
Okay.
Okay. Type of treatment. Treatment is different. Treatment is there. Medication, surgery, non-pharmacological treatment. Non-pharmacological treatment is includes ketogenic diet, vagus nerve stimulation, lifestyle modification. Okay, anticonvulsant therapy. First one is blocker of repetitive activation of the sodium channel. This is the phenytoin carbamazepine. Enhancer of slow inactivation of the sodium channel. One is lacosamide, rufinamide. GABA receptor enhancer, phenobarbital. And N and L calcium channel blocker, lamotrigine and valproate. And another one, current modulator, gabapentin, this one also lamotrigine, blocker of ununique binding site, gabapentin, and the last one is potassium channel opener, is izogabine. Surgery factor influencing decision. Likelihood seizure are due to epilepsy. Likelihood surgery will help. Ability to identify focus of seizure. Other treatment attempted, benefit and risk of surgery also. Okay, next one is vagus nerve stimulation. This is another treatment, something different. Device is implanted to control seizure by delivering electrical stimulation to vagus nerve in the neck, which relay impulse to a widespread area of the brain, used to treat partial seizure when medication does not work. This is when medication is not okay. You can use. Okay, this is a ketogenic diet based on finding that starvation, which burns fat for energy, has an anti-epileptic effect. Used primarily to treat severe childhood epilepsy, has been effective in some adult and adolescents. High fat, this we can use high fat, low carbohydrate, and protein intake, usually started in hospital. In hospital, usually we can start this diet for epilepsy. Require a strong family commitment. We have. Okay, other treatment like behavioral therapy, biofeedback, relaxation, positive reinforcement, cognitive therapy, aromatherapy is also. Thank you, sir. It's finished.
Okay. So, see, Sanaz. First thing is we have given you people liberty. You can stop recording. This is off topic.
Okay.
So we have given you liberty. You can choose any topic. Doesn't matter. Like you are not going